Morning. My name is Fermin Legan. I'm the acting chief health officer for the health district. The reason we are here today is because we wanted to share with you that yesterday a patient with a history of travel to China was admitted at the local hospital with respiratory symptoms. This patient, according to the CDC definition of patients under investigation, actually meets that classification. So therefore, we are working with the CDC and the local hospital in order to collect a specimen from this person and send that specimen to the CDC for confirmation of a diagnosis. So at this point, this person is not a confirmed case of novel coronavirus. Is what is called a person under investigation, pending a result from the CDC lab. I want to emphasize that as today, there is not any confirmed case of novel coronavirus in Las Vegas or the area of Clark County. And also that we are working very closely with the CDC, local hospitals and medical providers in order to keep a surveillance for those respiratory illnesses and be able to identify any case or suspect of a novel coronavirus in our region. So this is what we wanted to say today. We will stop here and then answer your questions. No, we cannot disclose that information.
So it's not Southern Hills Hospital at all?
As I said, we cannot disclose that information.
Are you not disclosing it as peers of the public or protecting the hospital?
Well, we are not disclosing because that's a way that we communicate information about diseases. We don't discuss individual patients or individual healthcare facilities.
Doctor, can you tell us a little bit, again, honoring the privacy of the patient, is there anything more you can tell us about the patient, male or female, roughly age range? You said this patient recently traveled to China, is that correct?
That's correct.
What can you tell us about this individual?
Well, what we can tell you is that this is a person who recently came back from China after spending over a month there in the region of Wuhan. That is the one that we know as affected by this condition. This person came back to the States and in January 24, starting developing respiratory symptoms, and it was a few days after arrival to this country.
So to confirm, the person who just went to Wuhan?
That's correct.
Spent their time in Wuhan?
Yes.
How are you investigating the case?
Well, we have communication with the hospital. We receive notification from the hospital when there is a patient with signs or symptoms, consistent with this disease or other communicable diseases. And based on the information we receive from the hospital, we initiate investigation. First, we try to confirm the diagnosis. And as I said before, this is a person under investigation. It's not a confirmed case of the disease. So we have to wait for the CDC lab to confirm the case.
How long would that take?
It would take probably 1 or 2 days. Do you have that information? Coming?
That's their expectation.
Yeah, around 1 or 2 days. They said from when they received it.
Right.
And they received
No, they actually, they will receive that specimen today. Yes.
Do you know if this patient, driving back to Las Vegas, flew in or drove in from an airport that flies you from China?
No, we don't have that information yet. Do you have that information? You can come over. You come in. Yeah, yeah. This is Dr. Croissant. He's our medical investigator. So you can answer the question.
We know this individual. We know this individual flew to the United States through a different airport, and then eventually flew into Las Vegas. This individual was asymptomatic during the whole time of travel.
When you say asymptomatic, does that mean somebody else can't get this while they are not showing symptoms?
So the CDC currently states that they only have evidence to support that someone can spread this disease when they are symptomatic. So, so as far as we know, this individual did not have any symptoms when they were traveling.
Doctor, help us out. Male or female, should we say a he or a she?
No, we are not actually defining the gender of this person because again, we want to protect the confidentiality of the person. So we don't think it's relevant what gender this person is, and we just want to share with you that there is a patient in the area that has been identified as a person under investigation according to the CDC criteria.
Will you be making the same answer if I ask approximate age?
The same answer would be, we don't want to disclose anything that could facilitate identification of this person.
Would you be able to tell us when this person arrived by air in Las Vegas, presumably McCarran?
I apologize. I don't know the information off the top of my head. It was McCarran.
Yeah.
And doctor, you said this person returned to Las Vegas. Is this someone who lives in or around Las Vegas?
Yes, this is a resident of Clark County, and that's the reason why we are disclosing this here today.
Again, that patient flew to the United States and then flew to McCarran, is that correct? And when did they, do you know when they arrived back in the United States? I apologize if we already.
Yeah, well, that person arrived in the United States in November 14. I mean, November, sorry. This is me now. This is January 14, sorry, my apologies.
What are the patient's symptoms and how sick is the patient?
Okay, you want to get that one? How, yeah, go ahead. Yeah, just my minor symptoms. Yeah, sure. Okay, just go ahead.
From what we've heard from the admitting providers, from the admitting team at the hospital, that this patient had very minimal symptoms, sort of consistent with, runny nose, cough, and shortness of breath.
Is the patient being completely quarantined or just monitored? How's that situation?
So the CDC, for anyone who's under investigation, they recommend that hospitals take standard precautions, contact precautions, and airborne precautions. And this is what this hospital or this healthcare facility is doing. So they're taking all the appropriate precautions at this time.
So it's in isolation.
And the patient is in isolation.
Doctor, so you said it was approximately 10 days he arrived here on 14th. They discovered the symptom on the 24th, correct me if I'm wrong. And during that 10 days, did he have any symptoms? Was there a risk of he or she spreading within these 10 days?
I apologize, I just don't remember all this information off the top of my head, and I don't want to give a misleading answer.
Right.
So.
Yeah. No, what we know is that this person was without symptoms during the travel to China. And at the time of arrival, the person was without symptoms. And that's common for infectious diseases. There is something called incubation period where a person requires certain number of days from the initial exposure to a germ into developing signs or symptoms. So that's typical for infectious diseases.
So we don't know how long he or she had symptoms before being admitted to the hospital. I guess that's another question.
That's correct. He probably have you have that one. Yeah.
Well, the reason why I'm not giving you specific dates is because I'm going to misrecall them, and so I don't want to be misinforming you. But I can tell you we have collected all this information, so we know the exact timeline, how long they've been infectious, and when exactly they presented to the hospitals. So the main thing is that this patient is a patient under investigation, and we're currently working on confirming whether or not this person actually has the infection. If this person were to be confirmed as a novel coronavirus case, then the health district would obviously take additional steps to identify contacts and hone down exactly people who are at risk and people who need to be monitored.
If there was a more severe case in southern Nevada, are all our hospitals equipped to take care of a patient with those symptoms?
You want to speak?
No, go
Yeah.
ahead.
I think any freestanding hospital should have the capability to admit this type of individual. So this is something, these sort of precautions that CDC is recommending are precautions that hospitals take for many other diseases. So yes, any hospital here would have the capability of taking the appropriate precautions.
Is there any way you can, this patient had symptoms days before admitted? I mean, was there any rough time frame you can give on that?
Perhaps we can get this information for you afterwards. I just don't want to misspeak, yeah?
Still at the podium for more colors. Would you give us your full name and spell your last name for us?
Sure. My name is Dr. Whit Kraushaar. First name is V-I-T. Last name is K-R-A-U-S-H-A-A-R. And I'm happy to give a business card afterwards if you want.
Would have never gotten that.
Yes.
Would you tell us what port of entry this person came into the United States from China?
Is there something you want to divulge?
But we probably don't want to get there.
Okay.
That port of entry that you're not disclosing, doing anything in particular different with flights obviously coming in from China? Do you know?
Yeah.
No, I mean, the port of entry is one of the port of entries already identified by the CDC for screening. As I said before, at the time of arrival, this person didn't show any sign or symptoms of respiratory illness.
Is this person someone who works in Las Vegas and does this person, well, first question, works in Las Vegas?
We haven't get there yet.
I don't know about patient's occupations.
No, again, this is something evolving that we just start working last night. So there are certain information that we cannot have right now, but also we wouldn't even be able to share with you about, occupation of this person or anything like that at this point.
My question was to go to, had the person, Dr. Kraushaar, return to work in the interim after returning to Las Vegas, then return to work before becoming symptomatic?
I can tell you that our disease investigators have done a more detailed interview with this potential case, but I don't have all that information at my fingertips at this time.
Can we at least say this is an adult?
Yes.
Thank you.
Doctor, you said that when this person arrived in the United States, he or she went through one of the ports identified for screening, and I presume, are we correct to presume that that person had been screened for coronavirus at whatever port he or she entered the United States?
Okay. Again, the screening that they do at the airport is a screening about looking for signs or symptoms of a disease. So I'm not aware that they do any, blood testing. So that would be the only way to identify coronavirus. They try to identify if the person, has any respiratory symptom, cough, fever, and then based on respiratory symptoms and the place from where the person is coming, they determine the risk of the person actually being a potential case of this particular disease.
Which gets to my follow-up in the sense that it's very plausible that somebody could arrive in this country carrying the virus, go through that screening, but be asymptomatic and not be caught in screening, correct?
Yes, and you're absolutely correct. And this is a typical example for that. And as I mentioned before, this is not uncommon from infectious diseases. You have a period of time when the person, after exposure to the virus, they don't develop any sign or symptoms because they haven't developed the disease yet. So the disease could actually present after the person is already in the country.
How many days can you go without showing symptoms?
Typically between 2 and 14 days. I'm sorry. The patient was hospitalized after about 10 days of arrival. It doesn't mean that this person was with signs or symptoms from day one until admission.
You said it takes 1 to 2 days to get test results. When exactly were those test results sent down? When could we expect possibly? I guess since you've been at the hospital for a couple days, when were they sent down?
The specimens are being sent to the CDC today. So the results should be available to the hospitals within the next 24, 48 hours. Yeah. About that? What's the patient condition right now?
As of last night, when I had a conference call with the CDC and the state and the hospital, the patient was in stable condition. Really very minor symptoms at that time.
Did that condition worsen, or is it something that gets better over time?
The novel coronavirus, it's a disease that they're still learning a lot about. But based on other coronaviruses such as SARS or MERS, patients can start off clinically well and then deteriorate. But also patients can just have a very mild course, like cold symptoms. Thank you.
People, some of this is being streamed. You're probably wondering, is there anything people can do to prevent themselves from getting this, or buying a mask worth your time?
Okay. One of the things, it's very understandable that people are concerned about this, given that it's a new virus and there's a lot of unknowns. But a lot of the precautions that we take during the flu season, the cold season, those are the precautions we're really recommending. So, frequent hand washing, washing for the appropriate amount of time and with soap. If you don't have soap, using your hand sanitizer is the next best option. Please don't touch your face or your mouth if you haven't washed your hands, because those are potential ways you can introduce viruses into your body. And it's still flu season, so we are recommending people get their flu shot as well. CDC has also put out a travel advisory to non-essential travel to China. So if you can avoid it, then I would not travel to areas where there are large outbreaks of this, such as Wuhan City. But as far as face masks go, I think that sort of makes people feel safe. But I think the evidence shows that really just the common sense things that we do every flu season are what people should be doing. And then please, one other recommendation is that, we live in a society where we all want to go to work and we don't want to miss any days, but if you are feeling sick, then please stay home. If you are someone who has concerns about whether you could be infected with this virus, we recommend that you call your healthcare provider. You can call the health district or the emergency department, but please call ahead of time before coming to these healthcare facilities. The last thing we want to do if there is someone who is potentially at risk is to expose other patients or healthcare providers.
I do have one other question. The patient themselves, I mean, obviously, like, people get told all the time, right? So how did this person know, like, they came from China, so I understand that, but was it somebody that reached out to say, hey, you should probably get this checked out, that they admit themselves? How did they get to say, okay, maybe I need to come to the hospital?
Didn't get the question very well.
Is basically if I'm understanding correctly, it's basically, did this person reach out? Yeah. Right.
Themselves, or did somebody say, hey, you were in Wuhan, you need to go get this checked out because you have a cold?
I believe in this case it was this individual, this individual has been aware of the news and what's going on, and this individual recognized that they had a risk from going to Wuhan and then developed symptoms. So, and that's another thing that we're seeing with some other cases in the U.S. is that these individuals were aware and they self-referred. So, the screening that's done at the airports is two-part. One is to identify people with symptoms, but the other is to spread information. And so even when people are asymptomatic going through the airport, educating them about, if they are potentially at risk. I think there's a lot of concern, the worried well, people who don't really have any risk factors and they've got cold symptoms. But I think part of this message is, if you travel to, Wuhan city or Hubei province in China, then that should increase your suspicion of risk.
Does this patient travel alone?
I don't have that information at this time.
Yeah, we just want to emphasize that the risk of transmission of this disease in Clark County, as well as the rest of the United States, is very low because that risk is limited to those individuals who have been actually exposed to somebody with the disease, which means that in any particular case will be, people sharing the same home or room with this patient, or people who actually spend time with the person could be a risk. But the risk for the general population at this moment is very low all across the United States. I just want to emphasize that. Okay.
Dr. Confidentiality, I apologize for getting some stuff here. Just the timeline again. This person arrived in the United States on January 14th. Arrived in Las Vegas when?
You have the date when they arrived in Las Vegas?
I don't have the dates in front of me.
We don't have that day of arrival in Las Vegas, but
Okay. But
we could get that to you.
But admitted him or herself to the hospital, what date was that?
Admitted that
Went to the hospital?
he went to the hospital. This person went to the hospital at 24.
24?
It wasn't because yesterday.
Maybe some of the
I'm sorry. Just apologize.
maybe some of the dates we can clarify after.
We can get back to you because we have information of this person coming to the hospital the 24, but I'm not sure if that was it.
Did they go to the hospital and leave at all?
You had that?
No, but I might just add something.
Yeah.
Dr. Mike Johnson, Director of Community Health. Just might add, as Dr. Legin mentioned before, that our disease investigators are doing a thorough investigation with the patient to gather a lot of information and answer questions that even we don't have at this point. So we will have that available. And should this become a confirmed case by the CDC, our disease investigators, as they routinely do, will follow up with close personal contacts of this patient to reach out to them and assess symptoms and travel history. Johnson, we'd like to go over what we did here earlier, because now I think I'm confused on, we said January 4th, reported respiratory symptoms. It was Dr. Legin had said a few days after returning to Las Vegas. That's what we said at the outset. So we have the January 24th date. Is that hospital admission date?
We will confirm that. We don't have that available at this moment.
Can we say return to Las Vegas January 14 or return to the U.S. January 14?
To the U.S.
We'll get those confirmed dates to you.
Yeah.
He or she comes directly to Las Vegas after arriving in the United States?
We can look for that information. Ian, right now we are investigating, right?
But there were no direct flights from.
No, right,
Hong
no.
Kong to Las Vegas.
No, that we said before, right?
Dr. Johnson, what's involved in an investigation? For example, right now, in the stage before whether or not we find out whether this is a confirmed case, what are your investigators doing?
Our investigators are in contact with the patient, acquiring a detailed patient history, where the patient was, symptoms, names and contact information for personal contacts, that type of information.
We'll probably get an update on this tomorrow.
We'll provide an update as soon as we have new information. So we're committed to providing you what we can as soon as we can.
I might also add that as of last week, there were 5 airports in the country that were doing screening upon entry to the U.S. There are now 20 that the CDC has activated. McCarran Airport is not one of them right now, and the quarantine port of entry for McCarran Airport is LAX.
Would you expect McCarran to be added to that list?
We have weekly Monday calls, national calls with the CDC for additional updates on this, and actually we're receiving emails and communication from them on a daily basis. So if McCarran is activated, it is CDC's call. We would be there to help assist.
Can you tell us, is McCarran currently being considered to be added to the list?
That's really CDC's call.
Las Vegas is a tourist town. I mean, is there anything being done differently, or is business as usual in the city of Las Vegas and the area when it comes to preventing something happening?
We've provided, our staff have provided lots of information about the novel coronavirus and precautions to take through health area network alerts to all of our local healthcare providers, to our hospitals, to our emergency medical service personnel, and our public health preparedness personnel. The CDC also has produced cards that identify the symptoms and criteria for basically the symptoms in the 14-day window, really, and if you were traveling to Wuhan, and what you should do about contacting your medical provider. And those are available at McCarran Airport as well.
When were those put out there?
Last week, I believe, sometime. Yeah.
Okay, that's it?
So you can be available for some one-on-one interviews.
Yeah. Okay, well, thank you.